fighting for better health care.
I want to know what happened and I want people to learn from it, that this is what you've done to this one family, and in most cases, people buckle.
I just wanted answers to why my wife had to go through that horrible experience when she was frail in the end of life.
I want the NHS to see their patients for us people.
And we also reflect on some of the week's big news stories. Good evening. Most people in Scotland report positive experiences of the health service, but that is certainly not always the case. Tonight we bring you the harrowing accounts of 3 families in Fife left devastated after the care their terminally ill loved ones received fell well short of the standards expected. NHS Fife has apologised for some failings, but the relatives are continuing their fight for full answers and want changes to the way complaints against hospitals are handled. Ewan Petrie has this special report.
It's left us feeling that she was taken too early because she had months to live. And you don't have to die that way.
Dying with dignity is something we all hope for ourselves and our loved ones.
I want to remember my mother as my mother, not as somebody who was treated with less than the respect that she deserved.
Often it's the NHS families turn to for help, support and compassion.
The effects of what happened has left me broken in many places, and I don't feel I can put myself back together.
3 families in Fife have been left devastated by care that fell short of standards we all take for granted. This is their story.
John was just a very straightforward, positive, optimistic, very devoted family man.
Trish's husband John was a teacher for more than 40 years. He was diagnosed with an aggressive bladder cancer in March 2020. When his condition worsened 2 years later, he was taken by ambulance to Victoria Hospital in Kirkcaldy, where he was met by a nurse.
I'll never forget her words. She said, "Put him in there." And the paramedic questioned her and said, "That's a sitting room. It's not an appropriate place for him. That's all we've got." No care. Didn't look at John. Didn't say, "How are you? We'll come to you soon, don't worry." So John was put into a sitting room. He was bleeding profusely. He had no control of his bowel or his bladder. And the indignity in that part of me was because he was still very aware. He was very aware he wasn't suffering in any way mentally, and he was in terrible pain. And he kept sort of grabbing my arm and saying, "Help me, help me." I was having to go out of that sitting room. There was no buzzer, there was no alarm that he could press had I not been there, to try and get a nurse or somebody to come into the room. Couldn't get anybody to come in. They kept saying, "He's not a priority." That was their words. "He's not a priority." I said, "He was a planned admission through the cancer helpline. He was brought in by ambulance for an appointment at 15:15. There was a bed ready. He's still lying on a hard, uncomfortable surface, and we're 3.5 hours down the line, and no medic has come into this room to see what he's like."
John was in hospital for 3.5 weeks.
There was neglect. There was absolutely neglect. If you're going to find your terminally ill husband in a soaking wet bed more than once, that's not okay. There was a huge lack of any real effort to make that, what was probably going to be his final few weeks, comfortable and in a care setting that was appropriate for his needs. It was atrocious.
John died on the 20th of June. Trish had raised concerns after his first admission to Victoria Hospital, but initially did not want to go through the process of a formal complaint. In October, she met with the head of patient experience, or HOPE for short.
It turned out that she was a clinical nurse manager on the ward that I'd had all the issues about, so I felt there was a conflict of interest. She's taking a complaint about her colleagues at this point. Now, to be honest, a red flag should have been up there for me at that point. But it wasn't, because I thought, I'm trusting, I'm only raising a concern. And I remember probably my last words to this girl were, I don't want this to become a long, convoluted complaints process. I want it dealt with because I need to try and sort my life, sort the life of my children, my grandchildren. I don't want to be constantly fretting about when this is going to be concluded.
Trish has since been diagnosed with PTSD by a psychologist. Much of it put down to what she witnessed in hospital.
I couldn't get past it. I just kept getting to this point, thinking, I can do this, but I can't go any further. I worked with him for 6 months. He was really good, but I had to stop. I never expected the end to be as it was. It was avoidable. It was totally avoidable.
It took more than a year after first raising concern for Trish to get a response from NHS Fife. To this day, their letter remains unopened.
They'll either deny it or it will be just their formulaic apology. We're sorry for what your family went through.
NHS Fife told us they acknowledged there were aspects of Mr Nolan's care that did not meet the standards patients should expect and apologised to the Nolan family.
I want to know what happened and I want people to learn from it, that this is what you've done to this one family. And in most cases, people buckle. They just buckle because you start the process and you want this done and dusted a couple of months and then move on with your life. You don't want to be left with these memories of that loved one being treated in that situation because the damage is done. It's too late, the damage is done.
My mum was a vibrant lady who loved life, loved her family.
Mandy's elderly mother Agnes went into Victoria Hospital with severe leg and back pain. She was moved to the Queen Margaret in Dunfermline after being diagnosed with terminal cancer.
She was very frightened about being in hospital. That was the thing, she was frightened.
It was only after her mother's death Mandy discovered she had been keeping a diary.
A nurse came into the ward today shouting at 4 a.m. in the morning for everyone to get up, that this was no holiday camp, but an assessment ward. Feel really worried, don't feel safe. Just want to get home as soon as possible.
Mandy and her sister have been going through their mother's medical records, trying to find out more about why she died so quickly. They had been assured she would be returning home.
Because I said it was unacceptable that they moved somebody with spinal injuries to actually get them to push themselves up the bed.
On one of her last visits, Debbie, a former matron in a nursing home, was horrified by what she witnessed.
I could hear her scream and I recognised it to be my mum. So I rushed up to where mum's bed was. She was in exceptional pain and I shouted, "Stop!" And I went and I looked in the curtain and I could see my mum and she was really distressed and I saw 4 staff and I said, "What were you doing?" She said, "Oh, we're trying to help your mum to move up the bed." And I said, "Well, how are you lifting her then?" And I said, "Have you not got a slide sheet or something?" And he said, "Oh, she's got a sheet, but it's in the cupboard." I said, "Well, do you not think that you should be taking that out of the cupboard and doing it right?" And I said, "Look, I don't want to interfere." I said, "But I'll go and I'll sit outside, but I'm not leaving." I said, "So I'll go and sit outside." And it just continued on and the screaming continued on. And I was so distressed that I put my phone on so that I could just record the problems that Mum was in, and she was just beside herself and I knew that something wasn't right.
We've chosen not to broadcast the recording as it's too distressing. 4 days later, Agnes passed away.
I couldn't grieve because I was so angry. You can imagine it was after the fact, so I couldn't say to my mother, or felt that she couldn't tell me because she felt I would complain, and that complaint would maybe lead to her going to be harmed further in hospital. That was very hard for us all to live with. That's had a huge impact on me and on my extended family, because we can't redress that.
Agnes's family received an apology from NHS Fife, but they want more transparency and accountability.
I want the NHS to see their patients for as people, that they need to be cared for, that they are the vulnerable and that they are the sick.
Every good man has a good woman behind him, but I can say that 100%, that's true. We're a partnership who worked 52 years.
Hiram had planned to make the most of the time he had with his wife Linda after she was diagnosed with terminal lung cancer. But a catalogue of errors in her care at the Victoria Hospital overshadowed their final days together.
She was left for 2.5 hours in a waiting room, sitting on a seat which wasn't designed for her terminally ill condition, with skeletal frame, and the fluids draining out her arms all over her for 2.5 hours. The nurse came to her and said, palliative care should have told you a bed's not available as soon as you come in. And we found this quite astonishing.
It was only when she got home he realised the full extent of what had gone wrong.
She then was sucked about 4 o'clock in the morning. She was telling me her experience. She hadn't had any water for 13 hours. She never got her medication, which was her steroids, because she wasn't properly booked in.
Linda died 4 days after suffering a stroke. Hiram took pictures of her arm, which swelled up after a cannula was inserted wrongly.
And that was the only agony or pain that she had. It was not from the cancer, it was from the damage and the harm that they caused her in that ward. When I eventually got her medical records, none of the records or any medical procedures was carried out of her on the ward, which was put in a cannula into her, were ever recorded. They've got no record, and they say, oh, we can't find any records. None. But you're not trying to convince me that 2 sort of shifts of charge nurses and nurses never kept any records of a patient who had medical procedure cards through their shifts. That's just astonishing.
Hiram was left furious after being told a lot of his questions around his wife's care would have to go unanswered. He took his case to the Scottish Public Services Ombudsman, the final stage for complaints about public service organisations in Scotland. It agreed that NHS Fife had failed to provide appropriate care and treatment. It also included 9 recommendations for the Health Board to put in place within a strict time frame.
I filed that complaint to the Ombudsman because I was getting nowhere with NHS Fife. You're supposed to deal through patient relations, but patient relations work for NHS Fife, so they're investigating themselves.
What do you want to see happen now?
I want to see an independent body, same as like what the police have got. If a policeman does something wrong, it's an independent body that investigates impartially and does it. But this should happen with the NHS, because I was a believer of the NHS before this, probably naively, when I went into it, and then I've come out the other side now, not trust them one little bit.
So this has been going on for years and years. You've been trying to get answers.
It's so much subterfuge of people trying to hide things, and I still haven't got complete answers of what went on and why.
After a career devoted to public service in the armed forces, Hiram feels badly let down by how he and his wife were treated by the NHS.
All I wanted was answers. I didn't want to go down this 3 years down the line, still be fighting them. I just wanted answers to why my wife had to go through that horrible experience when she was frail in the end of life by people who are actually very cruel to her. If you're a healthcare professional, you should be caring and help, especially someone who's at the end of their life. The excuse of, oh, we're understaffed, rubbish. You still do your job. That's what you signed up for. Do the job.
NHS Fife declined our request for an interview. It says it's committed to delivering safe, compassionate and what it calls person-centred care to every patient it serves. It says it follows a robust and transparent complaints procedure. But it does accept there are occasions when that level of care falls below the standards that patients can expect and deserve.
And there is other people out there who know this because they've been in contact with us.
3 individuals united in grief and a drive for change. They've been left disillusioned with a health service that let them down when they needed it most.
It's not even about getting an apology, it's about getting accountability and change. For me, that's what it's always been about, and it's not happened so far.
I'll keep going until I get all the answers I want because I didn't want this happening to anybody else. But I know it will happen to other people.
I should be thinking about the love and the care that my mum gave us, rather than as a patient at the hands of the NHS who was not treated with the respect or care that she should have had. And it makes me sad. It just makes me sad.
Ewan Petrie with that report. Well, as you heard, NHS Fife declined to be interviewed on this subject, but Ewan did manage to ask the Health Secretary about the NHS complaints procedure.
Are you satisfied that the current system is sufficiently transparent, robust, accountable?
I think that there are robust processes in place that can ensure that people can get the redress that they are looking for. I recognise where people find that difficult and where there are particularly traumatic experiences that can still be a difficult process for people, and we're always looking to make sure that from a health service perspective we are being as supportive as possible for people through a complaints process and making sure that it can be a learning exercise so that we don't see families or individuals going through the experience that we're hearing about today. We do have the Scottish Public Services Ombudsman, which is an independent arbiter of a complaints process, in this case with the health service. So if people feel that they haven't had the redress or the answers that they're looking for from the health service, the Ombudsman is there to take these considerations forward in an independent fashion.
Time now to reflect on some news stories of the past few days and put the week in focus.
You don't know. I may do it, I may not do it. I mean, nobody knows what I'm going to do. I can tell you this, that Iran's got a lot of trouble.
It's very clear, yes, we need to deal with the nuclear programme. There's no doubt about that in my mind, but it is better dealt with as a negotiated outcome, de-escalate.
Independence is the defining choice for this generation. Have no doubt about that. Because the UK status quo has proved itself incapable of delivering on the hopes and the ambitions of the people of Scotland.
That's the choice. A fundamental change of direction in Scotland, or we go on with the same old arguments and we waste a generation. That's not a risk I'm willing to take.
It's a difficult day for the university, but I have to say there have been many difficult days for the university since November. We need to learn the lessons from the Gillies report. We've already started that work.
Things are changing, and the way that people think about Scots, it isn't an uncouth, uneducated, working class lead. For me, I think it means less linguistic discrimination and more power for people to use the language and not feel uncomfortable about it.
Just the two guests with us tonight, the political commentator Katrina Stewart and journalist and podcaster Asa Samike Roman. Thank you both so much for joining us this evening. Let's start with the Middle East, and it's a very, very uncertain time in the world. We're all holding our breath to see what Donald Trump decides to do. Will America attack Iran, do you think, Kat?
Well, Donald Trump is so capricious that it's really difficult to say what he's going to do. He said earlier today that he would take 2 weeks to make a decision. You have to hope that in the meantime there is going to be a lot of diplomacy happening. This has huge knock-on effects for UK as well. There's problems potentially with the global supply chain with the price of oil. if the UK is expected to become involved in any military action backing the US, that's a huge problem for Keir Starmer because the UK doesn't have the necessary Navy personnel, it doesn't have the right sort of weapons to be involved in this. There just aren't the resources in the military. So it is a violent reconfiguration that's happening in the Middle East and quite a stomach-clenching time for everyone.
Yeah, and as the G7 countries are united in, not wanting Iran to have a nuclear weapon, what will those countries think about, potential American strikes?
It is a really terrifying time, and all of this is not happening in a vacuum. This is also on the backdrop of the utter devastation that is happening in Gaza. And obviously Iran, the Iranian regime, is an appalling regime. It's repressing dissent in blood. It's attacking women. It is a very destabilizing force in the region. It's hostile, it's threatening. But I think at the moment, definitely in France, but I think in the UK as well, we're talking a lot about 2003. And I think a lot of people are trying to ask the question, is this really a good idea to get involved in this way with Iran to try to have a regime change based on military action? I think, if you're British, if you're French, and you remember 2003, you think maybe this is not the right course of action, and you're very wary of what can happen in the future.
Okay, back here in Scotland, the First Minister John Swinney made a speech at this conference looking ahead to 2050, and he said that independence was within reach. Now, support for independence is high in the polls, but how close do you think it is?
Clearly, it's not a dead issue. Clearly, it's getting some traction. Some people, a lot of people still believe in the prospect of an independent Scotland. But independence for what? What's really the vision behind it? And this is something that, the SNP in particular has to articulate. You can have all the conversations, you can bang on the word, you can think about the strategy as much as you can. If you don't have weight, if you don't have a vision, ideas behind it, it's not really going to get anywhere, I'm afraid.
And I suppose this is the SNP's challenge, the Scottish election next year. How big an issue is it going to be?
I don't think it's going to be as big an issue as it's been in previous elections. Yes, it will be an issue. John Swinney has to walk quite a fine line between presenting a clear route towards independence and a clear sort of narrative and, as you say, vision about what an independent Scotland could look like in order to ensure that he's speaking to the core SNP vote. But he also wants to try and scoop up some of the people who've left and gone to Labour. He's certainly looking at tackling people who might go to Reform. So I think focusing on bread and butter issues is going to be a much bigger part of the strategy, but independence is really important.
Yeah, just very briefly, it will be interesting to see where they put it in their manifesto.
Oh, definitely, and definitely there will be voices in the SNP who will say we need to put it front and centre in the manifesto. We're only 11 months away from the next Holyrood elections, and I'm sure it's going to be a very interesting one.
Okay, and it's been a big week for our Indigenous languages in Scotland this week because Scots and Gaelic have been officially recognised as, or given official status as language. I mean, you're bilingual. What do you make of that?
I think it's so important to give the opportunity to people to learn different languages and to have this kind of, different grammars really in your heads. And I think it really broadens your horizons. It doesn't necessarily have to be, Mandarin or Chinese or Arabic. It's great that you can also learn languages that are the native languages of Scotland. I think it's fantastic. I speak neither, unfortunately, but I've tried with Gaelic. I think I'll try again, maybe.
Oh, because you tried it on Duolingo,
Absolutely,
you said that was quite tricky.
It's difficult. I don't think you can really become fluent in a language by just, typing a few answers on your phone, unfortunately.
I mean, Kat, what do you think of it? Because there are some people that say too much money spent on Gaelic TV, on the signs all around the country. What do you think about this idea?
I think the whole discussion around this is just really embarrassing. What sort of country confident in itself wants to do down its native language? And we are so poor at languages in the UK. Young people in schools are not that interested in learning foreign languages. We don't have people who are bilingual. I'm very jealous that you have 2 languages. And we really should be working to improve that rather than turning language into a culture war.
Absolutely. We'll all have to get back to Duolingo and maybe try Gaelic. But we'll have to leave it there. Thank you both so much for joining us. And that's all from Scotland Tonight. Thanks for watching. Good night.